we're excited to share with you how Curative is uniquely positioned to meet the needs of public sector clients. My name is Beth Henry. I am the Chief Marketing Officer for Curative, and we understand how important it is for you to deliver top-notch, high-quality, affordable benefits to your employees. And we are so fortunate to have our CEO and co-founder of the company, Fred Turner, with us. And he's going to talk about all of the ways in which Curative delivers value for both our clients and, very importantly, for our members. So, Fred, over to you.
Excellent. Thanks, Beth. Excited to be here today, sharing a little more about Curative and how we think we can deliver better, richer benefits and actually save money in doing so. So yeah, without further ado, we'll jump in. So a bit of history on the company, because we are obviously newer to the benefits space. So Curative was founded in January of 2020, actually initially working on improving sepsis outcomes in a hospital setting, which we did for all of about 6 weeks until COVID-19 hit and shut down all of the hospitals all across the nation. And we thought we could use some of our expertise in the lab industry to really help with the national testing effort. At the time, we thought it would be for a couple of weeks. Obviously, COVID ended up lasting a little longer than that. And so we scaled that effort from about 7 to 7,000 employees in a 12-month period. We ended up doing about 10% of all US COVID testing, about 36 million tests, and 2 million vaccines delivered all across the US in 46 states, across thousands of testing sites. We partnered very closely with local governments, states, counties, municipalities in delivering that and in setting up those sites. So we do have a wealth of history and experience of working with the public sector and partnering with the public sector to deliver healthcare at scale across the country. Now, obviously, the need for COVID testing was very large in 2020, but isn't there anymore. And so as we started to kind of think about what comes next for Curative, we were growing increasingly frustrated with the healthcare that we were able to get for our 7,000 employees. Nothing that we could find out there on the market was really hitting the mark in terms of delivering preventative care the way that we wanted to deliver it and doing it affordably. And so we decided that we could build something better. And that's really where the drive to build the Curative plan came from. And we got started in 2022, but we've been growing rapidly since then. So last year, we scaled about 4x from 24,000 members up to about 100,000 members on the plan, from just under 200 employers to now over 730 employers that are on the Curative plan. And a pretty large number of public sector clients are actually already using Curative. So we have about 30 school districts and over 25 municipalities and counties that are already using Curative for their benefits and have their employees covered by us. We do see really great member engagement. I'll talk a lot more about this later, but 98% member engagement is pretty unheard of in the benefit space. But that's what we're able to achieve with the Curative plan. So before we get into the details, just to level set a little on where are we at public sector healthcare in Texas. Obviously, there's a lot of challenges that the entire sector is facing right now, from legislative changes to funding challenges and budget compression. And we really see all of this impacting retention, with shortages for teachers and other staff, low ability to give pay increases, and rising healthcare costs. We see this really affecting attrition. And the statistics show that teacher attrition in Texas recently hit a record high of 13.4%. We really think that offering better health benefits, but doing that affordably, is a great way to solve that problem. So we think that there are really 3 key issues in healthcare currently that are driving a lot of unnecessary expense and negative health outcomes for employees. So high out-of-pocket costs, particularly high deductibles, make it feel for employees like they can't actually access their benefits. It's expensive to get even basic care. People worry that they're going to get a bill. They don't know what it's going to cost them. And this puts people off, but it puts them off most from seeking that preventative care. The complexity in the system today also is a big driver of this. We see people delay care until they're getting care in an emergency room rather than a primary care setting, driving much worse health outcomes because just actually figuring out where and how to access care can be challenging. And as part of that, there's minimal guidance for people to work with to understand how should they be accessing care and when is the appropriate time to do so. So yeah, the out-of-pocket costs, really, we see that driving a lot of unseen kind of downstream spend. So when people put off that preventative visit, it appears to save a little bit of money in that first year, but it ends up coming back as a much larger expense in those later plan years. And the out-of-pocket cost and the cost shifting to the member has grown so much at this point that 44% of patients across the US would not be able to afford to receive medical care, even if it would put their health at risk if they had an out-of-pocket cost above $500. So that is leading to 60% of people that have actively deferred care in just the last 12 months because of the out-of-pocket cost associated with that. We don't have it on the slide here, but the statistic that most shocked me was in a survey that we ran last year of people getting their healthcare from their employer. 10% of people answered that they have cut pills in half in the past 12 months because of the out-of-pocket cost associated with their medication. That is really bad. That cannot continue. That is going to inevitably cause significant health problems that not only drive worse outcomes for those employees, but will inevitably cost more downstream to deal with the negative health consequences of that. So Curative is trying to take a very different approach to this in the way that we build and design our plan. So the Curative plan, everybody starts off with $0 out of pocket. So for the first 120 days on the plan, all of our members have no copays, no deductibles, no coinsurance, $0 to go see a PCP, to have a baby, to get cancer care, whatever it is you need to do, all in network care is $0 for that first 120 days. And during that 120-day window, members need to complete what we call a baseline visit. I'll say a lot more about it later, but it's basically a mix between a preventative health visit and an onboarding to the plan. And as long as members do the baseline visit, they will continue to have no out-of-pocket cost for the whole plan year. However, if members don't do the baseline visit, on that 121st day, they will revert back to a $5,000 deductible, 20% coinsurance, and a whole bunch of copays. So it's a big $5,000 carrot and stick to engage just once a year, 1 hour of your time to think about preventative health, and then everything could be free. We do see that be very effective as an incentive for people. And so we do get 98% of our members engage and complete the baseline visit. We make it really easy for them to do so. Most of these visits are virtual. It's a Zoom call. We have them available in English and Spanish. We have a translation service into 210 other languages and ASL. So we really want to make it easy for people to do this, but we do see 98% engagement, which is pretty unheard of in the benefit space, to get 98% of people to engage in their preventative health. So we also find that we do need to show people the benefits grid, or they don't believe it. It really is zero in the left. That is the happy path if you do your baseline visit. For in-network care of all types, it is $0 out of pocket. That middle column there is if you do not do your baseline visit. You do see that $5,000 deductible and the 20% coinsurance. Again, it's only 2% of our members who ever end up there. We don't want anybody on that plan. We want everybody to complete their baseline visit. And then there is an out-of-network benefit. This is showing our standard PPO plan, but that does have a higher deductible. The network, I'll talk more about later, but it is a broad national PPO network with about 1 million providers. So there isn't ever really a great reason to need to go out of network. All right. So at this point, people usually ask, well, what's the catch? How does it work? How can you possibly offer this at $0 out of pocket? The key, and it sounds so simple, but the key is that we actually work with members to keep them healthy. The baseline visit is the start of that, and the engagement that we get from the baseline visit is the start of that. But it goes far beyond just the baseline visit and how we use that engagement to drive getting members to take care of their own health early, to get them to do the basic things that we know work, and keep them ultimately out of the hospital and out of those more expensive interventions that you would have to take if you don't deal with things in a preventative manner upfront. And by making that investment upfront in people's health to get them to engage, to get them to manage their chronic conditions, that allows us to pay for all of that $0 out-of-pocket cost. So the catch is you have to do your baseline visit, and we will actually work to keep your members healthy. So I've said a lot about the baseline visit. What does it actually entail? It's split into two halves. The first 30 minutes is with your care navigator, and everybody on the Curative plan gets assigned a care navigator. They're basically your concierge, your personal account executive. They are there. You can text them, email them, call them 24/7, and they are there to help navigate you through the system. So if you need help scheduling an appointment with a provider, they can sit on hold and make that appointment for you. If you need help with a prior authorization, transferring a prescription to a different pharmacy, whatever it is you need, they are there to help. And for that first 30 minutes of the baseline visit, they will basically onboard you to the plan. So they go over what is a copay, what is a deductible, because we find about 20% of people who come through the visit don't actually know what those words mean. And so it's not enough to tell them, hey, you have $0 out-of-pocket cost. You have to really work to make sure members understand what that actually means. It means if you feel sick, you should go see a doctor and it won't cost you anything. Because what we find is it's one thing to remove the cost barrier to people accessing care, but it's also really critical to remove the fear of cost. Because if people don't understand what is it going to cost me, and they fear getting a bill, they fear that it's going to be expensive to seek medical care, that is another key driver of why people put off getting that preventative care done until ultimately, what could have been a primary care visit is now escalating to an emergency room. And so you want to make sure that people really understand the plan. And that's what that first part of the baseline with the care navigator does. And so everybody comes out of that genuinely understanding how the plan works, how their benefit works, and how to actually get the care that they need. So we'll go over what does a network mean, how to use the in-network search tool to look up providers, how to nominate a provider to the network if they're not already in our network, which pharmacies they can use to fill their prescriptions at, how to transfer a prescription if they need to the Curative pharmacy that does free next day delivery for all of our members. So really kind of kicks off the plan in a different way and starts to build that trust and that relationship between the member and the care navigator, that they are there to actually help them to get the care that they need. And that's really helpful then for the follow-up that we do downstream from the baseline visit. So that's the care navigator portion. That's then followed by 30 minutes with a clinician. So it's either an MD or a nurse practitioner. And really what they're focused on is looking for gaps in care. So if you're getting your blood work every year, you're seeing your PCP, everything looks good, they're pretty much going to leave you alone. What they're looking for is that member that hasn't seen a doctor in 5 years or 10 years. And, maybe somebody told them there's something that they should be dealing with, but it's going to cost me to fill the medication. So I'll leave it alone. I feel fine. We see so much of that where people have just been putting it off, where their healthcare strategy is burying their head in the sand. And that's really where we drive the most value, is really working with those members to get them access to the care that they need. So again, we do see 98% completion of the baseline visit. Of the 2% who don't complete it, they tend to break down either into college-age kids who won't do whatever their parents tell them to do no matter what, or we see about 60% of that 2% are people that are actively interviewing at other places and are not planning to be on the plan. So it can be a useful tool to measure retention. Yeah, we do see 98% of people actually completing the baseline visit. One other thing just to note, it is all adult members on the plan who must do the baseline visit. So that includes dependents. Anybody over the age of 18 on the plan effective date must do their own baseline visit and then would be subject to their own deductible if they don't do that baseline visit. All right, so let's just look at a few examples of how we see this baseline visit going in practice. So George, a typical example of somebody who would come through the baseline visit, construction worker based in Austin, hasn't seen a doctor in 20 years, not aware of any medical problems. He only uses the ER or urgent care, but doesn't even remember the last time he did that. And through the baseline visit, we're able to basically welcome him back into healthcare, work with him to identify that he actually has type 2 diabetes, high cholesterol, and hypertension. We're able to connect him to care, get him set up with a primary care doctor. That's going to be $0 out of pocket for him. we can actually make the appointment for George, so he's much more likely to actually show up and engage in that. We can explain that at the appointment, they're going to probably prescribe him medication to manage the diabetes, the hypertension, and the high cholesterol, that's going to be $0 out of pocket, and that it's going to be available from the Curative pharmacy, delivered to his house next day for free as well. So George actually in this case decided to go with a Curative clinician for his primary care. So we are providing his primary care as well. And through this, we've been able to manage his diabetes, get A1C down to a normal level. He was connected to Pelago, which is one of our programs for alcohol and substance use, and connected to the HEB nutrition program to further help manage his diet and nutrition. So it's really getting people connected back into care and showing them that these programs are available, that they're available at $0 out of pocket, and making people feel comfortable starting to access healthcare in the right way. So we see a ton of these kind of stories where it's just getting people through the basic screening, having a primary care doctor, engaging with the primary care doctor. We know all of these basics work. None of this is rocket science. The key is, can you get those basics done across 98% of your population? That is the hard part. And that is the magic that we're able to drive with the baseline visit, is getting this done across everybody. That allows us to keep those long-term costs down and actually manage people's health. So another example, Myra, 55-year-old executive director at a local nonprofit, has more familiarity with the healthcare system, has been getting annual checkups, has always been health conscious, but has a family history of cancer. And so as part of her baseline visit with the clinician, we were able to go over the recommended cancer screenings, what's been done, discuss the family history, but we were also able to offer Myra access to the first of its kind multi-cancer early detection test called Gallery. This is from a company called Grail. It's amazing science. It's really something that's only become possible in the last few years. It's basically a single blood test that can detect up to 50 different types of cancer at stage 1 or stage 2, where they're much more easily treatable, where the cost to treat them and the success rate is much higher, rather than waiting for those cancers to become stage 3 or stage 4, which is where you would usually start to exhibit symptoms. By that point, treating them is much harder, much more expensive, and much less likely to work. So we are the only plan in the country that is broadly covering this test for any of our members above the age of 50. We so far have detected 9 stage 1 or stage 2 cancers that wouldn't have been found any other way. That's 9 lives saved by getting this test done. And so we really see this as the cutting edge of science, and that's really what health insurance should be for, is getting people to the absolute best medical care to avoid and prevent those early stage cancers that will ultimately progress to a later stage cancer if you don't deal with it. We want to find those up front, manage that care, rather than just avoid the claim this year, avoid the cost this year, and don't worry about what happens next year, which unfortunately is often the approach that we see health insurance taking. All right, so we really see this working. I'll show some of the statistics of how this is actually driving down cost for the employers that we're working with, and how that engagement is managing those long-term costs, providing that affordability, and allowing us to provide richer benefits at a lower cost. So we really see the engagement, particularly with telehealth. From the baseline visit, we set people up with access to telehealth, so they know how to use it, they know how to access it. We use both Norman MD and Teladoc, and we will set people up with an account, make sure they understand how to use it. So when you're in that urgent situation, you're not scrambling to download an app and make an account. You already know how to use it. It's there on your phone and you just hit the button. That makes it much more likely people are actually going to use that than going to the emergency room. But it's all about getting people set up in advance rather than being reactive in the moment. We also see great engagement for chronic conditions, diabetes and hypertension being kind of 2 of the key focuses here. Medication adherence is really what we see being key to this. So 95% medication adherence for type 2 diabetics and 93% for hypertension. Again, it's not rocket science. If people take their medication, they're more likely to stay healthy and stay out of the hospital in the emergency room. A big part of that is getting their medication at $0 out of pocket, but also all of the work the care navigators do to work with members to make sure that they understand how to access their medication and how to get that done easily and simply for all of our members. We also see about 5 times more engagement with complex case management than you would see on a traditional health plan. And we don't think that is because our members are 5 times more complex. We think what is happening is that we are actually identifying members early through the baseline visit before they've become high cost claimants, before you have that large expensive hospital stay, and we're then able to work with them to avoid that happening rather than engaging after the fact and trying to manage the cost down after, which is too late. We can get ahead of that and work with members to try to avoid those large claims before they happen. And we really see this working. This is some of the data on our inpatient admission rate on the Curative plan as compared to a Milliman benchmark. So Milliman, big actuarial consulting firm, they put out these 3 benchmarks for inpatient admission data. The poorly managed benchmark is in red. The moderately managed, kind of a national average, is the yellow line, and then their well-managed benchmark, which is usually the aspirational goal for health plans. It's where you're trying to get to but never quite get there, is that green line, and Curative is the blue line. So obviously lower is better, and we are solidly 30% below the Milliman well-managed benchmark. And we see this trend both for inpatient admissions, and then we also see the same trend for bed days. So all of that work that we're doing upfront to manage people, to get them to engage, to see a provider early, to take their medications, that pays off in actually keeping people out of the hospital at a measurable and appreciable rate. And that is really what pays for the $0 out of pocket and what allows us to offer richer benefits, but at a lower price point, and have that affordability both for you as the employer, but also for the employees, that they can afford to access the care that they need. So this is really key to how the plan works. I mentioned earlier the network. So the network is a combination of Curative direct contracts that we do ourselves with health systems, and then wrapped with something called the First Health Network. So First Health is a subsidiary of Aetna. It's a large national PPO network, about 1 million providers nationwide. We do have every major system in Texas. So we want to make it as easy as possible for people to access care. We want people to go and engage early, so we never want network to be a reason why people don't engage. And so, we do have as large of a network as we can get to make that as easy as possible for people to engage and get care. Now, one other thing I just wanted to highlight, because this is very unique to the Curative plan, again, kind of towards our mission of getting people to get access care early, is as well as offering the member ID card that obviously members get when they sign up for the plan, all of our members actually get issued with what we call the Curative Zero card. So this is a Visa credit card that is issued in your name, but it's fully funded by us. And it will work at any in-network provider. It won't work out of network, and it won't work at Chick-fil-A, which is the biggest source of where we see people trying to misuse it. But it will work at any in-network provider. And that serves a few purposes. The first is guaranteeing that our members will always get access to see a doctor. We don't want anybody to ever get turned away. We always want people to be able to get in and get care. And now, being a newer plan, we do sometimes see instances where smaller doctors' offices may not recognize the Curative logo. They should. They probably have a contract. They should definitely recognize First Health. But we never want that friction to ever impact our members getting care. And so everybody knows that they take Visa. And so if you're ever in a situation where you're stuck as a member, you can always just say, okay, fine, I'll pay the cash price. You swipe the card and you're done. And that friction then never impacts the member. They're always able to get care. On the back end, we'll go and work with that provider to make sure that they do understand their network status. The other thing we find is those cash prices are actually cheaper a lot of the time. And that actually ends up saving the plan money as well, because they're getting access to that lower cash price anyway. So also ultimately ends up saving money. The other place we see this be really useful is on the nomination side. So again, we want everybody to access care. We don't want anybody to have to change providers. If you're currently seeing a doctor that isn't in our network, you can nominate them. There's a form on our website. It takes 30 seconds, or you can text your care navigator, and we will attempt to contract with that provider, but that's often a slow process. In the meantime, we will give you an answer within 5 working days of whether or not you can immediately go see that provider using your Zero card. We accept about 94% of those nominations. And so most people can then immediately go see their provider with their Zero card. It'll actually show up in the provider search tool as Zero card only. Once one person has nominated a provider, anybody who's a Curative member can then go there using their Zero card. And so that allows us to rapidly provide that access and make sure that nobody is having to change doctor in moving to the Curative plan. I think one place in particular we've seen this be really advantageous is on the mental health side. Obviously, there is a significant shortage of providers right now in the mental health space. It is hard to provide great mental health benefits, but it is something that is an urgent need for employers. We see that, I think, broadly across the spectrum, but it affects the public sector as well to need to provide better mental health benefits. One of the best ways to do that is to allow members to keep seeing their existing cash pay only mental health provider. Those are providers that you cannot access with a traditional insurance plan, but with Curative, we allow you to access those cash pay only mental health therapists, psychiatrists using the Zero card. And so that gives us by far the largest mental health network of any carrier out there by enabling people to use a Zero card to really extend the network. So another great benefit that is part of the Curative plan. I won't go through every single one of these, but there's also a ton of additional programs that are available all at $0 out of pocket for our members. So we already talked about the Gallery test from Grail. That is a really unique technology that allows members to do that cancer screen from a single blood draw. But we also offer a number of virtual mental health, virtual therapy providers. We have Pelago for substance abuse. We have type 2 diabetes programs. We have Noom for weight management, which we see being very popular. That is available to any member on the plan with weight loss goals. There's no BMI threshold. Again, we want people to engage early and manage the care as early as possible. Okay, so one other area just to touch on where we're also able to drive substantial savings to the plan whilst also providing richer benefits to members is the drug side. So we have our own custom formulary developed in-house where for any condition you might have, there's always a $0 option. So if you have a super rare condition where the only thing available to treat it is a $500,000 a year drug, it will have a prior authorization. You'll have to meet the criteria, but assuming you do, it would then be available at $0 out of pocket because we don't believe that it's helpful to charge that member $100 a month for their life-saving medication. You're not helping to pay for the $500,000 with that $100 a month. All you're doing is increasing the chance that member doesn't take their medication as prescribed, ends up in the hospital, and now you're paying for the hospital and the drug. So that's counterproductive. So that would be available at $0 out of pocket. Now, if the member has a condition where there are multiple drugs available to treat the same thing, say one is a brand name drug, one is a generic, one is a brand and one is a biosimilar, that lowest cost but medically best option would be available for $0. And the more expensive options would either be at a $50 or a $250 copay, or sometimes if that price difference is particularly dramatic, they would be entirely excluded. And so we are able to drive substantial savings, mostly just by avoiding waste, steering people to those lower cost options where it's exactly the same thing, it's the same drug. I think biosimilars is where we've really seen a lot of this saving, particularly with Humira going off patent 2 years ago. Humira is $6,500 a month, but with a $2,000 a month rebate, so $4,500 net to the plan. The biosimilar is $500 a month. So we have 100% conversion efficiency to that biosimilar. We've never seen any issues on the medical side of converting people. It is the same drug. It works just as well, but it is $4,000 a month of saving by avoiding that brand name Humira. Carriers, other health insurance retain that brand name drug on the formulary because they're getting part of that $2,000 rebate. So we are always trying to minimize and actually get to lowest net cost. And through that, we've been able to drive very substantial savings. So we are running at $61 per member per month cost on the drug side right now, compared to a Milliman benchmark of $105 PMPM. And actually the PBM that we work with, their book of business is running at $148 PMPM. So really driving substantial savings while still getting members their medication at $0 out of pocket. 98% of our members, 98% of drug fills on the Curative plan are happening at $0 out of pocket. You can get your Dupixents, your Biktarvys, expensive specialty medications at $0 out of pocket. And we're able to do that while still delivering savings back to the plan by avoiding all of that waste in unnecessary brand name drugs, whether are generics or biosimilars available. So we really view this as a long-term partnership. We want to partner with employers, particularly in the public sector, for the long term. And we view this as working to keep costs sustainable, both for the employer, but also for your employees, keeping it affordable long term. Managing down that long term spend is really key. So, what we see is in the first year, there is sometimes a little bit of an increase, particularly in the first few months, due to pent up demand for care that members really should have gotten, but have been putting off or delaying because of the out of pocket cost. But we get through that pretty quickly. And then into the second and third year, we actually see a decrease in medical cost as a result of all of that investment in the first year. And then long term, we see a much lower trend than you would see on a traditional health plan because we're proactively managing things. We're avoiding the chronic conditions before they happen. We're avoiding those hospital stays before they happen. And that allows us to bend the cost curve and keep costs down. Now, we do share this back with you. And so we will look at and often will quote 2-year rate guarantees for groups. So we want to, again, be providing that long-term sustainability of cost to you, where you know what your costs are going to be in those later years because you're proactively managing them. So showing this for some real data for some real curative groups. This is our first cohort of members that started on the plan January 1st in 2023 and have been with us now for a full 2-year period. And what we see is they see a negative medical trend into their second year. So in their second year on the Curative plan, they spent over $100 per member per month less than in that first year. So again, you make the investment in preventative health, in engagement, in the follow-up from the care navigator in that first year. That allows us to actually manage and keep costs down, keep medical trend here at negative into that second year by managing the health of those members better. You can see in the graph here, there's a little uptick at the beginning. People deal with that pent-up demand. They deal with the things they've been putting off, but that more than pays for itself in the savings that we see through the long-term sustainability of the spend here. All right. Another point I really want to emphasize, we just last week had our AM Best A- rating reaffirmed by AM Best for the third year in a row. Obviously, as a newer carrier to the market, we know this is really important. They look at all of our forward projections going out 5 years to see that we have the financial backing, that we have the financial strength to be doing this and to be doing this sustainably and growing sustainably and profitably. And we did maintain our A- rating again for a third year in a row. So just to summarize, Curative really enables public sector employees to actually get the care they need when they need it. So we remove the barriers and the hurdles, copays, deductibles, out-of-pocket costs that prevent people from getting access to the care they need. That allows us to provide a much richer benefit that employees love. If you're getting $0 out of pocket, for your prescriptions, you have a $0 baby. We have members getting cancer care at MD Anderson for $0 out of pocket. That is a benefit that is going to make you want to stay with your employer. You're not going to want to go somewhere else where you have a $5,000 deductible to access any kind of care. We see this really drive massive retention improvements for the employers that we work with. It is something unique that lets them really stand out. And we can do that usually at a very competitive, if not lower price point. So being able to offer richer benefits without breaking the budget, we see this as a great tool in the public sector where, you're maybe fighting for talent, sometimes fighting for talent with the private sector. And if you're not able to fight hard on salaries, benefits is really somewhere where you can get that long-term buy-in from employees because they feel like you're taking care of them. They feel like getting that first dollar coverage, they're getting health benefits they can actually use and actually keep themselves healthy. So it's been very successful so far, and we see it being a great advantage and a real benefit. Right? We talk about benefits, but a real actual benefit for those employees. But don't take our word for it. Here are some of the testimonials from our members. We do also survey our members, and we get a net promoter score of 78. That is a Ritz-Carlton level of net promoter score. Most health plans are scoring single digits or negative. The way that net promoter score is calculated, in order to get a 78, that means at least 78% of people gave us a 9 or 10 out of 10. So I think this is pretty unique to the insurance space. You don't usually hear people talking about loving their health insurance, but that is something that we really see people say about the Curative plan, that you can have benefits that people actually love using. And with that, we'll wrap up there and take any questions that people might have. Thanks everybody for joining. Really appreciate everybody getting on the call.
Okay. All right. That was great, Fred. Thank you. So again, we're going to open this up to questions. If you've got questions, you can put them into the chat, and we'll spend as much time, at least we've got another 4 minutes or so, that we can put Fred on the spot, and maybe I'll just get things going as folks can think through this. And I have to have give a call out in the chat from Shelly, who is actually a Curative client, and is saying that 5 months in, it has been really great for their employees and a great recruiting tool as well. So thank you so much for that feedback and that endorsement. One of the questions, though, we get is like, is this too good to be true, Fred? And how are we Curative? How are we making money on our solution? And probably more importantly, from the client side, what's that going to mean at renewal? Are we going to get slammed with a high renewal rate? So if you could respond to that.
Yeah, I think as we talked about a little bit, the key is really keeping people healthy. And with the high deductible plans, just kind of kicking the can down the road, something that could be simple to intervene early on, low cost intervention early on, ends up costing an awful lot more downstream. So just looking at cancer, for example, with the way we approach that with the Gallery test. If you're treating a stage 1 or stage 2 cancer, it costs 8 to 10 times less than treating a stage 3 or stage 4 cancer. Now, that's even just ignoring the massive benefit from a human side of the outcome difference between a stage 1 or stage 2 compared to a stage 3 or stage 4 cancer, where you often at stage 1 or stage 2 talking about full cure, full remission, whereas stage 3 or stage 4 you're usually talking about how many months to live. Even ignoring that, there's an 8 to 10 times cost saving on what you're going to spend on the claims there. And so if you have that stage 1 or stage 2 cancer and you can identify it early, you can treat that for $50,000. It's not going away. Like it's going to be there next year. It's going to be there the year after. If you don't treat it up front, you're eventually going to end up spending the $500,000 on claims. It's going to be there eventually. And so if you can get ahead of that, deal with it in advance, manage that long-term cost, that is how we pay for the $0 out of pocket.
Yeah, fantastic. I mean, I think it's pretty well proven that today's high deductible plans are only kicking the can down the road, and they really aren't bending the cost curve at all.
Yeah.
So one other question is, can Curative cover employees who are outside of the state of Texas?
Yes. So we already have members in all 50 states. We can cover people wherever they may be, as long as the group, the employer, is based in either Texas, Florida, or Georgia. We can cover people nationwide. And if people are traveling, right, if they're working for a school district in Texas, but they are traveling on vacation outside of the state, they would be covered. We have network access nationally. And so we absolutely can cover people anywhere.
Fantastic. Again, folks, if you've got questions, feel free to drop them in the chat. Maybe another one, Fred, since launching Curative, like what has been the most surprising thing for you as we've brought this incredibly innovative and differentiated solution to the market?
Yeah, I think something that surprised me the most is probably just the amount of low hanging fruit that's sort of come out of the baseline visit. I thought that maybe it would be more challenging to find these opportunities to intervene and get people better care. But the number of people that come through with, pre-diabetes or diabetic complications or hypertension. We had a member come through a few months ago that just told the clinician, oh, by the way, I'm HIV positive, but I've never taken any medication for it because I can't afford it. Like, that's crazy. If you don't deal with that up front, it is ultimately going to drive hundreds of thousands of dollars of claims cost and obviously significant negative outcomes. And the fact that there are people in the system that are just putting off getting that kind of care because of the out-of-pocket cost. I mean, I think before we all knew there was a problem, but it didn't, the magnitude of the problem wasn't, I think, apparent until we really got into it. And there's so much opportunity for us to really work with those members, get them the right care, and just drive much better health outcomes that ultimately keep everybody's costs down.
Yeah. So maybe last thing, because I do want to be respectful of folks' time, Shelley again provided some great feedback here that she's representing a small city with about 125 employees, and they've found our 24/7 customer service to be incredibly helpful for their team members. And I guess, it kind of leads me to like just the unique support that Curative provides to our members. And it's not just our 24/7 member services, but it's also our care navigators. And maybe just if you could speak to how differentiated that is.
Yeah, being able to have that personal relationship where you're going back and it's one person who understands you, you've met with them, there's a relationship there. You do have 24/7, 365 member services, but you also have that individualized care navigator. Particularly for members that have more complex care needs, being able to check in with the same person rather than, you call up and you're getting a different person every time. It just makes it much easier if you're having that relationship with somebody on the health plan side who is on your side and fighting for you.
Mm-hmm.
And so, yeah, we've seen that be a really great benefit. Also, being able to text them. I mean, it sounds so simple, but text is so much easier that I think that makes it much more accessible for people. I can take the HSA question from the chat as well. Somebody's asking about
Perfect.
HSA for tax saving and wealth strategies. If the curative plan is not HSA compatible, our advice is that people should put their money in a 401k. There are very few people that are maxing out their 401k. If you're getting all of your healthcare at $0 out of pocket, there's no need for an HSA because there's nothing to spend the money on. Everything is already covered at zero. And people will be better off putting that money in a 401k and taking the better benefits. The challenge with the HSA plans is to be compatible, you'd have to have a deductible. And what we see is if you try to offer a high deductible plan alongside the $0 out of pocket, the problem is the young people all pick the high deductible plan. They still defer all of their care. They don't engage. They don't get any care until they get sick. And now they want to come on the $0 plan. What you really want to do is have everybody on the zero so that everybody can engage ahead of time, proactively manage their health, and then they're not getting to that point when they're getting sicker and sicker and needing to engage in a higher plan. So you want to get everybody on the plan because that's how you actually proactively manage the population.
Which makes so much sense, right? So it's so simple and so true.
Yeah.
There's one other question here about whether or not Curative has holistic health doctors available in our network.
There are, yes, holistic doctors in the network.
Fantastic.
And if you have one that you really like and they're not in network, you can nominate them and go there with the zero card.
Yeah. We also got a great comment about, how a lot of cities, municipalities will bring in vendors to do biometrics. But when you've got a Curative $0 plan, there's really no need for that because employees can go to their PCPs and get care. We fundamentally believe that PCP relationship is so incredibly important in maintaining someone's health over the long haul.
Yeah.
What group
Group
sizes do we
sizes.
cover?
So we'll go anywhere from 25 enrolled employees up to as large as you want. We have groups that are 5,000 plus lives on the plan today, so we can work with groups of any different size.
Fantastic. Looks like we have gotten all of the questions in. I just want to thank everyone again for attending today and for hanging in there with us through our initial technology challenges. Great questions, great feedback, and we are so appreciative of that and look forward to just having more dialogue around how Curative can really serve the public sectors.
Yeah.
Thanks again and have a great rest of your day.
Thanks, everyone.